Welcome to my channel Medicine Guide. Meropenem is a carbapenem antibiotic. It treats some infections caused by bacteria. It will not work for colds, the flu, or other viruses. Common brand name: Merrem. In this video we will discuss about some precautions, interactions, side effects of this medication. So let's start our discussion. But before that, please subscribe to my channel Medicine Guide. Now let's start with precautions. Precautions: brain tumor, kidney disease, seizures, an unusual or allergic reaction to meropenem, other antibiotics or medicines, foods, dyes, or preservatives. Pregnant or trying to get pregnant. Breastfeeding. How to use this medication. This drug is injected into a vein. It is usually given by a healthcare provider in a hospital or clinic setting. If you get this drug at home, you will be taught how to prepare and give it. Use exactly as directed. Take it as directed on the prescription label at the same time every day. Keep taking it unless your healthcare provider tells you to stop. It is important that you put your used needles and syringes in a special sharps container. Do not put them in a trash can. If you do not have a sharps container, call your pharmacist or healthcare provider to get one. Talk to your healthcare provider about the use of this drug in children. While it may be prescribed for children as young as newborns for selected conditions, precautions do apply. Overdosage. If you think you have taken too much of this medicine, contact a poison control center or emergency room at once. Note: this medicine is only for you. Do not share this medicine with others. What may interact with this medication? Birth control pills, probenecid, valproic acid. This list may not describe all possible interactions. Give your healthcare provider a list of all the medicines, herbs, non-prescription drugs, or dietary supplements you use. What should I watch for while using this medication? Your condition will be monitored carefully while you are receiving this medicine. Tell your doctor or healthcare provider if your symptoms do not start to get better or if they get worse. This medicine may cause serious skin reactions. They can happen weeks to months after starting the medicine. Contact your healthcare provider right away if you notice fevers or flu-like symptoms with a rash. The rash may be red or purple and then turn into blisters or peeling of the skin. Or, you might notice a red rash with swelling of the face, lips, or lymph nodes in your neck or under your arms. Do not treat diarrhea with over-the-counter products. Contact your doctor if you have diarrhea that lasts more than 2 days or if it is severe and watery. Do not drive, use machinery, or do anything that needs mental alertness until you know how this medicine affects you. What side effects may I notice from receiving this medication? Side effects that you should report to your doctor or healthcare professional as soon as possible. Allergic reactions like skin rash, itching or hives, swelling of the face, lips, or tongue. Bloody or watery diarrhea. Fever. Fever with rash, swollen lymph nodes, or swelling of the face. Pain, redness, or irritation at site where injected. Pain, tingling, numbness in the hands or feet. Rash, fever, and swollen lymph nodes. Redness, blistering, peeling or loosening of the skin, including inside the mouth. Seizures. Unusual bleeding or bruising. Side effects that usually do not require medical attention. Report to your doctor or healthcare professional if they continue or are bothersome. Constipation, diarrhea, dizziness, headache, nausea, vomiting, stomach pain, vaginal discharge, itching, or odor in women. Where should I keep my medication? Keep out of the reach of children and pets. That's enough for this video. If you want to watch more videos, please keep watching my channel. Disclaimer: channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications, or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guy.